Okay. So when we're doing this skill, the patient is going to be already stationed on a bedpan, on a pad already. So you don't have to place a bed pad up under her. No waterproof pad. It'll already be there. So what are we going to do for this skill? So the first thing we're going to do, we're going to knock on the door. Good afternoon, Miss Allen. My name is Tanita. I'll be your CNA today. I'm here to place you on a bedpan. She says it's okay. I'm going to do my hand hygiene until my hands are what?
Completely dry.
Completely dry. I'm going to provide my patient privacy. I'm going to lift the bed up to a working height. I'm going to check the bed for safety, making sure it's locked. I should have done that first, but you want to just make sure the bed is locked. It was locked already. So I'm going to need gloves for this skill. A barrier to put on the table. Now in this skill, your proctor or your RN test observer is going to tell you which bedpan that she wants you to use. There's two types of bedpan that you can particularly have. These are also state test questions. This is called a standard bedpan. Standard bedpan is placed on the patient at the hips, the narrow part to the feet. So when you applying it, it should look like this. This is called a standard. This is for any person to use a standard bedpan. A fractured bedpan goes on opposite. This is a person who had a hip replacement and they don't want the hips on there, so they're alleviating the pressure. So this one goes wide side to the feet and the narrow side towards the hips. This is test questions as well. These are the two types of bedpans that they may ask you to use. So applying them, you want to apply them accordingly. Standard, wide side towards the hips. Fractured, wide, the narrow side towards the hips. You want to make sure that you remember that because she can alternate or tell you which one she wants you to use. So you don't want to get there and think, oh, I'm just going to use, and these can come in different colors. So it could be yellow, pink. Don't get caught up in the color because if it's pink and it's fractured, it's still a fractured pan. Same thing with the standard. If you get a gray standard pan, you're still going to put a standard one on the same way you're supposed to. Wide side to the hips. Fractured, narrow side to the hips. So let's just say she told us to use the standard bedpan. So we're going to apply the standard bedpan. So you need your standard bedpan. You're going to need some toilet paper for the patient. You're going to need some hand wipes or a face towel. So whichever one is no wrong way. Depending on where you're at, if you have hand sanitizer, you can use hand sanitizer. But if you have wipes, or you can use a face towel to clean the patient. Because at the end of the skill, it's going to ask you to do something. So, and then we need a barrier. So we want to put a barrier over Miss Allen so that she's not exposed. So the first thing I'm going to do is, I've already provided her privacy. I'm going to remove her car light out of the way. This is also on a live person. The patient's going to be laying in the bed on a bedpan the same way I'm just putting this on here. And then the first thing you're going to ask that patient, and the scenario says that they can lift their hips with some assistance. So when they lift their hips, you're going to just ask her, can you lift your hips a little bit for me on the count of 3? 1, 2, 3, and you're going to put the patient on the bedpan. This is going to be a live person, just making sure their clothes is not in there and make sure it's lined up with their hips. So you're going to have them in their hips. You okay? Now I'm going to cover her up with a barrier. And then I'm going to let the head of her bed up so that she can be a little more comfortable to evacuate or void, whichever one she's doing. She's not laying down flat. So I'm going to leave her like this. I'm going to put her tissue in her hand, her call light next to her so that she can call me. You're going to step out from behind the privacy curtain. Now, I've seen people take their gloves off. It's not necessary that you take the gloves off because you haven't provided any care. But if you were taught that way, go ahead and take your gloves off. But you do not have to take the gloves off. You're just going to step outside the curtain. The observer's going to tell you she's done. You're going to come back in. Correction, one thing I forgot to get, you're going to measure the urine. So you're going to get your graduate cup and have that graduate cup on that barrier table as well so that you can measure the urine. So the first thing I'm going to do is let Miss Allen's head back down. Miss Allen, you okay? Everything's fine? So I'm going to let her head back down. And before I touch her, I'm going to put some of my supplies away so I don't have to go do that later. So I'm going to put the toilet paper away because she's already used it. And then I'm going to remove my call light, her call light out of the way. I'm going to take and hold the bedpan. So when you're removing the bedpan, you're going to take the bedpan and you're going to hold it down in a downward position. It's a test question. You're going to hold it down and pull it from up under the patient. You're going to pour the content into that graduate cup. Now, I have one in the graduate cup that's already here. So you would have your graduate cup after you poured it in there. You're going to measure it at eye level. So you would measure it. Remember what that content is in the cup. And then once you know what that is in the cup, you're going to discard that. So I'm going to first, before I do anything, I'm going to clean Miss Allen's hands. So again, you can use wipes or a rag, a wet rag. So I like to do the wipes because it's just easier. I got the wipes here. I don't have to wet it. It's already wet. So all I have to do is clean Miss Allen's hand. Clean, clean, clean. Clean, clean, clean. Pull her gown down. This is going into the dirty linen. So I'll be discarding this into the dirty linen. Now, all I have to do is go empty this. I got to remember what that number is in my mind. So I'm going to take these two to the toilet. I'm going to empty the basin in the toilet. Empty this graduate cup into the toilet. I'm going to empty it in the toilet. Rinsing it once. I'm going to turn on my water. Paper towel. Rinse it once, rinse it twice, rinse it 3 times. I'm going to sit that down. I'm going to put a barrier down and sit this on the table here. I'm going to rinse the bedpan out, rinse it once, rinse it twice, rinse it 3 times. I'm going to sit that on the barrier. I already have barriers down. So I'm going to take one. I can turn the water off now. I'm going to take one, clean the inside, throw it away, grab another piece of paper towel, clean the outside, throw it away. Grab another one to clean the inside of the basin. Clean this out, throw it away. Outside, throw it away. And I can put these together and carry them back to the area that I have because I have a barrier here. So I'm going to put my graduate cup back, my basin, my standard bedpan back, discard the paper towel. Now I can throw this away, put my wipes, put the wipes away. This I didn't use. This was just if you wanted to use a face towel. So that's discarded into the dirty laundry. This goes in the dirty laundry. Now I'm going to take my gloves off. Now I can't express how important it is taking the gloves off. So you're going to pinch in the middle. Ball it up, go with under the glove, discard it into the trash. Now you can get your patient together so you can cover her back up because your hands were clean before you started. Miss Allen, you need anything? A glass of water, anything like that? She says she doesn't need anything. Then I'm going to leave her environment cleaner than what it was when I started. So I'm going to just make sure she's down. I'm going to let her bed back down. Open up her privacy curtain. And then as I'm washing my hands, I'm going to go through the steps of my skill. Did I knock on the door? Announce myself. Let the patient know what I was doing. Providing her privacy. provided safety and let the bed up, let the bed down. I did that. What was the skill? The skill was to put the patient on a standard bedpan. I did so. I let her, she cleaned herself, she was able to lift her hips. I measured the urine. I'm keeping that number in my mind because it's going to be a sheet of paper that they give you that you're going to print your name and sign at the bottom, and it's going to have output on there. I'm going to put the output that I put on there after I've done all of this. I'm going to go over to that sheet and document the urine after I went through everything in my mind and make sure I did all of the skill. Once I've done that, I'm going to tell my proctor my skill is complete. Please click like, subscribe, and share if you like these videos. I'll be bringing them to you on a regular basis, but this is just how to do it for headmasters in the state of Michigan, and it may be applicable in your state. Thank you and have a nice day.